Good morning. Today I'll be discussing the case study of Mr. David Nizal and specifically his chronic obstructive pulmonary disease exacerbation. Firstly, let's discuss his A to E assessment and how the findings should inform our clinical decision making. David's airways are patent and maintaining on his own. He is able to clear secretions currently as he has a productive cough showing yellow sputum. June 2023. This indicates there is no immediate obstruction, although continuous monitoring is necessary to maintain an open airway. David is tachypneic with a respiratory rate of 30 breaths per minute. This indicates respiratory distress. Curtis, 2019. He is also hypoxemic with low oxygen saturation at 78% on room air. These breathing observations indicate the immediate need for supplementary oxygen therapy according to the Thoracic Society of Australia and New Zealand guidelines, Beasley 2015. David's use of accessory muscles, including the tripod positioning and the presence of wheezing and crackles, further confirm his compromised breathing, Lang 2020. After starting oxygen therapy for David, you could discuss with his doctors possibly charting bronchodilator therapy, such as salbutamol and ipratropium, along with potential cortisone steroids to further assist with his oxygen levels by opening up the airways. Yang 2023. David is experiencing sinus tachycardia with a heart rate of 128 beats per minute. This is consistent with David's body responding to hypoxemia and added respiratory distress, Kraft 2022. He is also suffering with hypertension with an elevated blood pressure of systolic 168 and diastolic 85. This reflects the increased stress on his cardiovascular system due to his current respiratory condition. His capillary refill time is delayed and his peripherals are cool, indicating poor perfusion, which may suggest worsening hypoxemia and further need for the close monitoring. Dabchek 2022. David's Glasgow Coma Scale is 14 out of 15, reflecting mild confusion, likely due to the hypoxia. Curtis 2019. Although his levels of confusion is near normal, it should be closely monitored because hypoxia can worsen neurological function rapidly. David is febrile, indicating an underlying infection, likely exacerbating his COPD symptoms. This is consistent with his positive COVID-19 test and his worsening purulent sputum production, suggesting the need for bacterial antibiotics. Lang 2020, Co 2016, and Australian Institute of Health and Welfare 2024. Now we will discuss high priority nursing interventions for managing David's expression of COPD. Firstly, we have the administration of controlled oxygen therapy. For patients with COPD, we want to provide enough oxygen to maintain saturation between 88 and 92%. This ensures enough oxygenation while preventing hyperoxia. Lower saturation level is important in COPD patients because excessive oxygen can suppress respiratory drive, leading to CO2 retention. This can lead to worsened respiratory acidosis. Barnett 2022, MIMS Australia 2024. Next, we have the administration of bronchodilators. These can be medications such as salbutamol and ipratropium. These bronchodilators alleviate bronchoconstriction and reduce respiratory distress by improving airflow. Salbutamol acts rapidly to relax airway muscles, while ipratropium offers prolonged effects. Curtis 2019, Dabchek's 2022. Additionally, given that COPD exacerbation often results from infections. Using antibiotics like azithromycin that target bacterial infections can help reduce inflammation and improve respiratory systems. This would be beneficial for David given his fever and purulent sputum. Leng 2020, Yang 2023. And now we have positioning David in a high Fowler's position. And this can enhance lung expansion, helping reduce work of breath and thus improving oxygenation. This positioning helps alleviate dyspnea by reducing the diaphragmatic pressure. Kraft 2022, Beasley 2015. Now let's look at some nursing considerations when administering therapies and medications. For David, monitoring his oxygen saturation is crucial. Since he has COPD, we aim to keep his saturation between 88 and 92% to avoid any risk of CO2 retention, which can lead to worsened drowsiness or confusion. We need to regularly assess his breathing and respiratory rate, check if he is using any accessory muscles, and watch for signs of hypoxia. We'll start with nasal prongs or a Hudson mask, making sure the equipment's working well and that there's enough humidification to avoid drying out his airways. MIMS Australia 2024. But too much oxygen can cause problems, so we'll need to keep an eye out on him to prevent any oxygen toxicity or CO2 buildup. Other side effects can be coughing, chest pains, and nausea. Now we have salbutamol Ventolin. We're looking for a relief for wheezing and shortness of breath. After giving it, we'll check his lung sound heart rate and make sure his breathing improves. Since it can cause tremors or a rapid heart rate, especially with frequent use, we'll be on the lookout for those signs. It'll be administered through either inhaler or nebulizer every 4 to 6 hours, and we'll check his inhaler technique if he's using one on his own. MIMS Australia 2022. Now we have ipratropium atrovent is similar to Ventolin, but works slightly differently to open up his airways. We'll assess his breathing to see if there's an improvement and watch for any side effects like a dry mouth, headache, dizziness, or throat irritation. It's usually given via nebulizer every 6 hours, often in combination with Ventolin. We'll also be careful if he has any issues like urinary retention or glaucoma, as this medication can sometimes make those worse. MIMS Australia 2022. With prednisolone is a steroid, so we'll need to keep an eye out on his blood sugar, especially if he's diabetic, as steroids can raise glucose levels. We'll also monitor for signs of infection, since steroids can suppress the immune system. And watch for mood changes like irritability or trouble sleeping. Prednisolone is taken orally, preferably with food, to prevent stomach upset and can cause weight changes and fluid retention. MIMS Australia 2021. With azithromycin is an antibiotic to tackle any underlying infection. We'll assess his temperature and sputum production to see if it's working. Since it can affect the liver, we'll be keeping an eye out on his liver function and ensuring he stays well hydrated. It is given intravenously initially, and then orally can be taken with or without food. Common side effects are nausea, diarrhea, so we'll monitor for those as well. MIMS Australia 2024. Lastly, we have niramatrivir and ritonavir is an antiviral combination for his COVID-19, and we'll have to be particularly cautious about liver function. It's important for drug interactions, especially with his statin or Lipitor, which may need adjusting. The medications are taken twice a day for 5 days, and adherence is crucial to ensure the best outcome. Some common side effects from this drug can be GI upset, hypertension, and headache. And we have my reference list at the end here. And I just want to say thank you so much for listening to my presentation.